Hi everyone, my name is Jenny. Today I'm going to talk about leadership in clinical practice. In healthcare settings, nurses play an important role in identifying and attending to changes in patients' health conditions, preventing deterioration in situations, and supporting patients throughout the recovery journey. Nursing literature shows that effective nursing leadership impacts positively not only the quality of clinical care, but also the entire working environment that nursing is conducted. Therefore, in this presentation, I will discuss the definition of nursing leadership and its significance in clinical practice, followed by my elaboration on the preferred leadership style. What is nursing leadership? Like any leadership, the concept is complex, yet not universally agreed. The nursing leadership, as expected, warrants a wide range definition and is often poorly understood. It is commonly regarded as management and seniority in hierarchy. However, some say it has nothing to do with personal attributes. The term leadership is to develop a vision and to enable people working towards changes. Nursing leadership has been defined as influencing and supporting others to improve the quality of care, along with a way of engagement in clinical care participation. Nursing leadership is an interactive process where team members are motivated to accomplish an agreed goal. It essentially provides staff with a clear pathway and empowering drive. According to Australian College of Nursing, leadership is to create a long-term strategy to help people engaged to work towards changes. Nevertheless, describing leadership in nursing literature is a difficult and multifaceted process. To cover the base of nursing leadership, it serves as a foundation to effective nursing care that provides directives and guidance to staffs, as well as support and comfort patients and families. Furthermore, it functions as building blocks to collaboration and communication in everyday operations in order to achieve an optimal patient outcome. Clinical nursing leadership smooths out nursing care delivery, such as evidence-based practice monitoring, evaluating patients' outcome within a continuously improved framework, assessing and minimizing risks to individuals, efficiency and coordination, improvement in clinical patient care. Why nursing leadership is important? Nursing leaders are experts in the fields as they are effective communicators and empowered decision makers. As a necessity, they are clinical knowledgeable, competent, and subject matter expertise in supporting and nurturing patients and families. A clinical leader is an influential registered nurse who is in the center of patients, families, and healthcare professionals to fulfill the role of health service integration in order to achieve a better patient outcome and experience. Clinical leadership should be focused upon patients and healthcare teams rather than formal leadership position. Effective nurse leaders create an atmosphere that promotes staff with more passion and enthusiasm on the job. Nursing leaders play an important role in yielding a safe and effective environment that results in high quality of patient care. In healthcare settings, nurses are instrumental in providing effective communication in between healthcare workers and ensuring the quality and continuity of patient care. Effective nursing leadership introduces room for patient care improvement that leads to positive results. For example, study shows that clinical leadership improves the safety and quality of care, such as medication management, wound care, infection control, and patient education. Studies also suggested that effective leadership is essential in reducing mortality rates, as the increased acquisition of inspiration and initiatives that boost job satisfaction due to the cultural change brought by the leader. There are 4 leadership styles based on practical leadership theory. These are directive leadership, supportive leadership, democratic leadership, and achievement-oriented leadership. Today's focus is limited to my choice of leadership style, which is democratic leadership. This is desired because it encourages team members to share thoughts and be actively involved in the decision-making process. And here are the 3 main reasons that justifies my thought process. Firstly, under democratic leadership model, each team member is involved in the daily decision-making process and having a taste of being a leader, which in return achieve an increased job satisfaction. By taking ownership and the sense of being in a big family, it's highly valued by the leader, and it's important for each and everyone to feel comfortable by willing to voice concerns and opinions. Secondly, in a democratic leadership promoted environment, members are encouraged to share their thoughts and ideas as a result in diversity and creativity in problem solving. And it benefits positively at work environment for nurses and other health professionals. Literature suggests that positive work environment has a significant influence on patient experience in the quality of care. Thirdly, reputable organization values transparency and the input from frontline team members by relying on leaders to create a culture that promotes the input from all members on deck. In addition, democratic leadership style is associated with a lower patient mortality rate. Research also showed that democratic leadership style is closely related to increased patient satisfaction in acute care and home care settings. In this presentation, I have talked through a thorough definition of nursing leadership and leadership in general, as well as the disruptive nature of nursing leaders in healthcare industry. Then I have elaborated on what talents are considered as suitable in a nursing care leader, and the different styles of nursing leadership, and the style of my choice that, in my opinion, is the most effective and positive. Now I have listed the quality of nursing leadership, and in particular democratic leadership. My question to you as my fellow nursing care professionals: what is your preferred leadership style? And do you have what it takes to be a leader? This is the end of my presentation. Thank you for listening.